Welcome to Healthcare IT Unplugged. Today, we're going to talk about what is on your network. Healthcare organizations have gone digital. We have many devices that are digitally enabled now that need to be connected to a network. Do you know what is actually on your network? And once it's on your network, do you know how to continue to manage the security threat? Because patches and updates are always coming down the line. And today we're going to talk to an expert in this field and very involved in the standards around cybersecurity and medical devices. And I hope that it is a wonderfully complimentary episode to Dr. Stephen Baker's that we recently interviewed. But Ali's with a healthcare organization. So now you've heard from Dr. Baker on the medical device manufacturer side, and now you're talking to somebody in the hospital. So I hope this is enjoyable, and always let us know your thoughts. All right, well, welcome. Thank you for being here, Ali.
Yeah, thank you for having me, Sean.
So Ali is the director of medical device and IoT security at Henry Ford Health Systems. I also have worked with Ali on a number of industry groups where we're trying to set policy and regulation around our space to try to improve the many aspects of what we do in healthcare IT. He's an author. I actually have his book here. Wi-Fi enabled healthcare. It's great. And of course, I'm a believer in Wi-Fi and healthcare, right? In many ways. Hence the unplugged nature of our show. Been in this business 22 years. Have various certifications on the technical level, and including the CWNE. It's a wireless network expert. CISSP and all of the elements that are appropriate. Well, our goal is to explore different perspectives, and we like to keep it lighthearted. So we really want to hear from you. And we've been under a lot of changes in the security industry in healthcare for quite some time. As technology has continued to advance, the threat landscape has continued to advance. And in healthcare, correct me if I'm wrong, but we don't exactly adopt the latest in technology, do we?
No.
Yeah, so we there's a history of a bunch of old devices and operating systems and software and drivers. And so you're the guy that owns this problem.
Yes, Sean. Yeah, we're dealing with, on average, devices are anywhere between 10 to 20 years old, some of the legacy devices.
Mm-hmm.
And ironically, even some of the newer devices coming out will sometimes have legacy technology integrated in them.
Yeah, brand new old devices, right?
Exactly.
And people talk about, we think of the life cycle of IT. I'm leaving off the healthcare part of this is IT is 5 to 7 years for some network infrastructure devices. 7's getting long in the tooth. And then
Yeah,
for end user devices, I mean, you're talking like 2 to 3 years, right?
3
Anymore.
years is usually what we're dealing with. Yep.
But we have this world of medical devices. So you're responsible for medical device security and now this new area called IoT. I'd love to just hear more about your role and where your focus is.
Sure. Yeah, Sean. I mean, at a 10,000 foot level, the role is ensuring that devices that we're using for patient care are safe and effective. Now, you would think that that's something that's handled by medical device manufacturers, but the reality is you can take a device that's designed really well in a lab environment, and when you introduce it into a hospital environment, it's a totally different animal. And you really have to go to great lengths to make sure that you're not introducing additional vulnerabilities. So my nightmare scenario is essentially having a medical device in use on a patient that is compromised, whether it's from an integrity standpoint. Uh, if a clinician is programming it to do something a certain way and it appears to be functioning properly, but in reality it's not, for example,
Yeah.
these are the things that keep me up at night, and that I try to address.
And knowing you as long as I have, maybe 10 plus years, you have a big heart. You're in a passion for healthcare and doing the right thing. And let me tell you, I mean, these are been conversations that we've been engaged in for years, and we're really intensely focused on on trying to solve this problem. But why do you think we're in this situation, not just in healthcare, but as a whole, but relate it back to healthcare, please?
Yeah, sure. So I think one of the reasons is, so I started my career as a medical device design engineer. And I could tell you network integration was the least of my concerns. I was worried about meeting, we're trying to release a medical device. So we're looking at occlusion pressure. We're looking at, this was an IV pump, flow rate accuracy. Is the flow rate actually what it's intended to be? These are the types of things that you're scrutinizing. You're not really looking at, the software bill of materials, or how will this device integrate with other devices on the network. These are usually an afterthought. Now that's becoming more and more prominent now, but it's still something that seems to be an afterthought in some cases. I don't think design engineers are really thinking it through well enough. We're beginning to see this shift now, but I think it will take years before to materialize in a major way.
So this is great, and it really reflects on my experience as well. Being in technology most of my career, you know what those cycles are. You're innovating, you're trying to solve a problem, and you're trying to become, frankly, a marketable company with being to be a going concern with profits. So you're so focused around making sure something works and to do its intended purpose. So in medical devices, right, it's to, if it was infusion pump or whatever those aspects are, there's different functional requirements for parts of it. And usually by like second generation of a device, version 2.0, if you will, we'll harden it, like to make sure all the bugs start to get out. And then we'll make it secure, I would argue, in version 3. And in medical device manufacturers, I'm always heard saying this. Even wireless and connectivity, these are all afterthoughts. Do you agree with that?
Oh my gosh, I could give you an example. I was looking at a mobile X-ray machine a few years ago. And this was a device that's, the price point it's almost $500,000 for this device. It's not a cheap, instrument.
Mm-mm.
And as I started scrutinizing the Wi-Fi capability of this device, I found out that the Wi-Fi card was at the bottom of the station behind a bunch of metal, essentially. The antenna was the wrong polarization. So they couldn't have done, if they were trying to intentionally design something that would have poor connectivity, that's how it would have gone about it, is the way that that they designed this device.
Well, that's where they have room. So they had a void of space in the bottom, right? It's a problem, Ali.
Pretty much, yeah.
Why are you being difficult?
To make matters even worse, Sean, this device the Wi-Fi card in use was around a $10, card that they're using in the device. I could not understand that.
Yeah, and I've seen these. Well, we have a USB port. We're just going to go ahead and throw a USB port into this, and they realize, why do we keep dropping? Well, the power isn't always consistent, right? And these things tend to be flaky. Yeah, I mean, sometimes you're afraid to look when you see a device come in. You're like, oh, God, what am I doing? What am I dealing with today? If you were to think about a process, so whether it be yours or whether it be recommendations for an organization, you're a healthcare delivery organization, you care, and you're in the IT org. How should the process of procuring devices and getting certified to be onboarded so that they're secure? How should that process go?
Sure, yeah. So that's a great question. I mean, it's a fundamental question that we deal with. So as you mentioned earlier, I'm dealing with legacy medical devices, and those need to be dealt with over time. And there are ways and mechanisms we can use to mitigate risks associated with those.
Mm-hmm.
But really, you don't want to be introducing new devices to your environment that introduce additional risk, essentially. So you need to scrutinize what's coming into your environment. And so I used to be laser focused on Wi-Fi and mobility and really understanding, what IEEE standards they support, what type of authentication does this device support. But now, since I've shifted my focus more to security, really I'm concerned with making sure that they have a software bill of materials, making sure that they have the MDS.
Tell me about software bill of materials at a high level.
Sure, yeah. Just understanding what components are being used to build this device, what underlying operating system, what drivers, It's really fundamental to have this understanding, because often medical device manufacturers and engineers will resort to using the easiest path essentially available to them, which might be using Windows XP, a legacy operating system, and building
Because we already have it on our other devices. We already know we already have processes and people designed around doing that. So we're just going to call that same team and they're going to help us. Yeah.
Exactly. They're taking the path of least resistance, right? So one of the other key documents that I ask for is the MDS2 to security disclosure from the manufacturer. And you want to be sure that you're getting the latest edition. I mean, if I'm getting an older version of this file, usually I'm thinking, okay, do they have their house together? Are they focused enough on security? Is their house in order, essentially, around security? If it is, they should have the latest, format that I'm looking for with this document. So asking those types of questions and scrutinizing how the device will be used, will it have patient information? What type of authentication does it support? Does it integrate with Active Directory? These types of questions are really important.
So we had our friend Dr. Stephen Baker on for an episode, and he talked about software bill of materials, and it's a new concept. I'm just trying to drive that idea in people's heads. Somebody went from physical servers to virtual servers. It's like going from physical components that we can see, touch, and feel on devices, but inside there are all these electronic subcomponents. And it's not just one brain. Sometimes you have many brains. So the software bill of materials, you might have all these different computing devices inside. They even may be on one circuit board, but still, nonetheless, they're independent, autonomous elements. Even the Wi-Fi radio that's in these could have its own ASIC and compute module, right, which can be exploited. So
Yes.
I'm just trying to reinforce what you're saying, because it's a new concept and people need to understand this a little bit more.
Yeah, look at some of some recent vulnerabilities, like Log4j, for example. You'd have a really difficult time telling being able to discern if a device is vulnerable without having the software bill of materials to understand. All right, is it running Java? What Apache libraries is it running? On the back end. These are things that are not usually available to you.
Speaking of recent vulnerabilities, I pulled up an article sourcing. This is from HIPAA Journal. Can you see my screen? Okay.
Yes, it's a little
Very
small,
good.
but I can see it. Yep.
Okay. Over the last year, so it's looking at U.S. healthcare data breaches, mind you. So we think about, we live on a planet here, but in the last 12 months, these are the number of data breaches, and some of these data breaches are smaller, some of them are larger. And I want to go down to, and I don't want to pick on organizations per se, but I thought this was interesting. I'd love to get your reaction to this. At this point, maybe the first time you're seeing this, but the causes. And this is what we need to kind of calibrate people to. It's not just attackers or hackers. So tell me about this from the perspective of your organization and the things that you do on a day in and day out from the causes.
Sure. Yeah. I mean, so I think one of the areas to focus in when it comes to these types of causes is the low-hanging fruit. And really the easiest way to hack into an institution is through social engineering, right? So you want to make sure that your workforce is educated, has at least a basic level of education around security. Things like password management are really important. They're very basic, but they're important. So I think getting those types of things out of the way first is crucial.
So I thought you would find that interesting.
Yeah, thank you for sharing that. I mean, another thing is when you're looking at the level of data crunching that you're talking about, a lot of times we're relying on cloud infrastructure to be able to accomplish that. So it's not necessarily on-prem servers. And one other thing that caught my attention on there that I think is really important is email. Phishing, the prevalence of phishing, and just being aware of how to identify suspicious emails. What markers to look for. I think these are things that it's low-hanging fruit, but it's critical.
So every organization has security teams. Are they not doing their job?
No, I mean, I think security teams are doing their jobs. It's just, if you look at the number of vulnerabilities coming out, there's about 50 a day, I think, or there was 50 a day last year. So to be able to keep up with that and figure out, is it relevant to our environment? you really need to have a very good understanding of what your environment is, like a very thorough inventory of what it is that's actually connected to your network, and are these vulnerabilities relevant, to these types of devices.
Yeah, and this network segment, I mean, this segment is on what's on your network, right? And
Yes.
so tell me, how do you know what's on your network in the big, from a macro perspective?
Sure, yeah. So we have, you have network access control platforms. And
Yes.
actually in the medical device space specifically, I found that after doing a gap analysis of the types of systems that IT typically leverages for this, I found that there is a gap, and you do need tools that are dedicated to IoT and medical devices and medical device security specifically.
Yeah, the good ones combine the two. And IoT, give me your definition of IoT because there isn't one standardized one. So when you say medical devices and IoT, help us out how you think about it.
Sure, yeah. IoT, essentially, I view anything that's communicating machine to machine communication as IoT. And generally, it's some form of a sensor that's relaying information either to a central server or another device.
I like that definition.
So, yeah, I think of essentially refrigerator temperature monitors, for example. Uh, there's some HVAC platforms. Medical devices do fall under this umbrella because a lot of times they are communicating autonomously to other devices, whether it's the EMR or another system. So that's kind of how it is a very broad definition,
Hmm.
but that's how I like to think of it.
Yeah, you and I have studied this segment and compare notes from time to time, and we talked about this network access control area. It's kind of a traditional um, IT security IT appliance, if you will,
Yeah.
in that you talked about that gap, and specifically, what is the gap?
So one of the key gaps is identifying and validating that a device is actually a medical device or an IoT device. I've run into instances where, for example, I'm looking at a glucometer and
Mhm.
it shows up as a Nintendo DS device within a traditional NAC
I mean, it could be.
platform because essentially they're using the same Wi-Fi card, that Nintendo DS uses on this particular
They
device.
source it from the same supplier as a Nintendo card. Makes sense.
Exactly.
Or
So it
doesn't.
shows up that way, right? And you run into that over and over again. So I think these new platforms are basically they're combining the MAC address of the device plus what is it actually communicating with? How is it communicating on the network? And then they combine all that information and then determine and tell you with a high level of confidence what the device is.
Yeah.
Not just what it is, what the underlying operating system is, what firmware it's running, and oh, by the way, are there any open vulnerabilities that you need to be aware of for this device?
And
How
and
much
this
risk are
sounds
they actually
and this
introducing?
sounds logical why we would all want this, but it's actually a really hard problem to know what to get this data without manually doing it or doing any kind of perhaps harmful interrogation of the device because there are tools like Nmap is one and probably
Yeah,
others that you can really start hitting it with a bunch of queries, if you will.
yeah,
And we have seen in some of the security evaluations we've done it quote unquote brick the device. It
yeah,
made it inoperable. So, for example, infusion pumps, like it's infusing a drug, and the security team, hey, I'm just going to do a daily pulse to see what's on my network. I'm going to interrogate it. If you brick it,
yeah. I mean, it's
these are
really
the things we worry about.
yes, yeah.
You
It's really
mentioned it
important that
earlier, yes.
I mean, if you're looking at establishing a lab environment, you have to make sure that you have dedicated devices for that environment. You can't take a device out of a clinical environment, put it in a lab, do these tests on it, and then return it. I mean, I've heard of nightmare scenarios where the calibration on the device is thrown off by this interrogation. So you
Me
put
too.
it back in the clinical environment, and all of a sudden, it's not doing what it's intended to do in the way that it's intended to do it. Essentially, it's not
Interesting.
infusing at the right rate, or so that type of
Huh.
scenario can arise as well. So it is really important that you keep those worlds separate. And a lot of the tools I'm referencing essentially are passive
Yeah.
listening devices that are then crunching and making sense of the data and giving you insight about the medical devices.
Would you disagree with this statement? And I'm going to use this. Think about from the organizations and groups that we're involved in. if you get them over a drink and they're 2 drinks in, and you ask them, "Do you know what's on your network?" How do you would you say that they'd be like, "Man, there's a whole bunch of stuff I don't know what's on my network."
I think very few institutions could give you an accurate depiction of exactly what's on their network. Maybe
I
they would
think,
capture most of it, but I think, yeah,
yeah,
that would,
you get the 80/20 rule. I think most people would know what 80% is. But I
yeah,
can count on one hand with no fingers the number of organizations that know 100% what's on their network. And I say that that's my opinion. I would love to hear if you passionately disagree, and if you're with an organization, you have a control over this. But I would argue there's mitigating controls to how to deal with the problem. When you don't know whatever is on your network, there's posture and some things that you can do to protect yourself. And that
yeah,
includes putting them on isolated network segments that maybe just have internet access. Like, for example, it's not
yeah.
that you're not going to get onto your network if it's done right and police that right. Do you disagree?
No, no, I agree. I mean, that's really the mechanism that we take with legacy medical devices is exactly that. It's micro segmentation. You're putting them on their own network where they can only access what they need access to,
Very good.
and nothing more.
What is the average security competency of an HCM professional?
Yeah, that's a great question, Sean. So I'm very involved with the AMI organization. I do know quite a few HTMs, and unfortunately, that field is changing at a very rapid pace, but it has not caught up from a security standpoint. So a traditional HTM is still dealing with preventative maintenance, essentially dealing with trying to meet the mandates and the requirements of the Joint Commission. That takes up most of their time, essentially, making sure they're servicing equipment routinely. But really, they're dealing more with mechanical work, whether it's a cracked screen or a bad
Yeah,
motor or something like that. HTM as a whole, I think, is starting to look at cybersecurity and IT integration a lot more closely, because what medical device is not connected today, right? I mean,
very few.
I'm going to say very few don't have some form of integration
Yeah.
into a network. So I think that's an area, and you'll see AMI is focused on this now. In fact, they've put out a couple of courses targeting that specific audience,
That's
getting
fantastic.
HCM professionals familiar with IT concepts.
Anybody not familiar with AMI, AAMI, fantastic organization. And for all of you folks that want to maybe in IT or healthcare IT that want to understand what it's like to walk in your colleagues' shoes over in the HTM in your HTM teams, I would highly recommend it. And they have an annual conference coming up in June. I want to say in
Yes,
San Antonio. Okay.
yep, June 3rd.
Yeah, some segments to go into. I can never say this enough. Our IT colleagues don't often leave their cubicle or their office building.
Yeah,
Get the hell out of there. Go walk in the hospital. Go to a conference. Go learn about something besides what you do. You might actually understand what some of your colleagues deal with, right? And to be able to come together, and like you said, they're coming to these teams are coming together. In fact, they're under one, senior manager.
they
Uh,
are. Yeah, they'll
Mhm.
report up to the CIO in a lot of cases. And really, the flip side of that, Sean, is people that are ingrained in the IT function don't understand the life critical aspects that HTM is dealing with. It's a different world. Uh, what we call an event on the IT end of things is very different than what like an HTM professional would call an event. So even from a semantic standpoint, the verbiage is different. So there's some learning on both sides, I think, that needs to take place to get us to where we need to be.
So let's wrap it with this. So what advice would you give either somebody in healthcare IT or in the HTM teams, Clintech and Biomed? Where should they get started to go to make sure that they're doing the right cybersecurity steps and to protect their organization?
Yeah, that's a great question.
I only ask great ones.
I mean, the first thing is really to recognize this as an area of focus. So, like at Henry Ford, for example, they established a leadership role around this space specifically to build out a program. I think that needs to happen initially to bring visibility to the issue and just put it in context. It's really difficult for IT and HTM to relate to each other on the level that's needed here. You really need someone that's running a team that is handling it and pulling in the appropriate
And
stakeholders.
what are those minimum viable components that you would call that's your setup for success to set up your team? What are those subcomponents?
Sure, yeah. I mean, you have to define a formal program, and I actually have a great template for a program with 12 focus areas, and some of
Mm,
it revolves around what you had mentioned as far as working with sourcing to understand what's coming into your environment and having a formal process around that. The other key thing is reconciling your inventory. You really need to do your best. And you may not be able to get to 100%. You need to have a good understanding and the ability to quickly isolate and recognize the devices that are the highest risk to your environment.
yeah.
And that is an impossible task to do manually. Like you mentioned, you're talking to some vendors that specialize in this space. You need some sort of tool, an IoT and medical device security management tool in order to wrap your arms around that. From what I've seen, it's not something you can handle in a manual fashion, regardless of the size of your team. It's not something that can be accomplished with boots on the ground.
Yeah.
There's just too much information to keep track of, and stay on top of over time. And it changes on a daily basis. So,
Well, my friend, thank you again, and looking forward to seeing you soon in person now that we can travel.
yes, likewise. Thank you, Sean.